Well, I want to officially welcome everybody to our second annual Bluff Red Ribbon display that we do here in Long Beach. For those of you who just joined us when you're walking over here, or for those that were at the center earlier on, we're here remembering World AIDS Day. It's an international day where we take a moment to recognize that there are people not just in Long Beach, not just in California, not just in the United States, all over the world, that are living with HIV or have passed from HIV/AIDS, and that it's still a challenge, it's still a fight, it's still something that the center and the CARE program are doing together to reduce numbers and everything. So with today, I would like to introduce a couple people to you who are very important to the fight that we're fighting in Long Beach, to get people tested, get people into care, get people aware of the services that are out there to keep them negative if they are negative. So with no further ado, I'm going to introduce Dr. A from the CARE program to give us a little feedback. I would say your full name, but I'm afraid of messing it up. And give you just a little bit of feedback about what the CARE program is doing to actually fight HIV in Long Beach. So good round of applause for Dr. A, please.
There are like very bright lights shining in our faces, and so it makes it so I cannot see any of you or what I wrote down. So anyway, I'm Dr. Marcia Alcouloumre, as you said, Dr. A, and I'm the medical director at the CARE program at St. Mary Medical Center. And for those of you who don't know, CARE program is the Comprehensive AIDS Resource Education program to provide medical care, dental care, case management services, social services to people who are living with HIV and AIDS. And at the CARE program, we have been there for over 25 years, and we currently are providing services to over 1,600 people who are living with HIV in this community and in LA County. So as all of you see around you, this of course is to commemorate World AIDS Day, and we remember those who we have lost. We remember those who have fought with HIV in the past, who have advocated, who volunteered for trials, who also those of you who provided support for people living with HIV and AIDS. And when I think back on the early days when we gathered for World AIDS Days, this was about remembering, and this was also about when we're treating people, that still so many people were dying. But now I ask you to remember, but I also ask you to look at the themes of the current World AIDS Day. President Obama and Secretary of State Hillary Clinton have committed this to an AIDS-free generation. And is that possible? What does that mean to us? And the theme of getting to zero, what does that mean for all of us here in Long Beach? So I just came back from Washington, D.C., where there was a national convention about meeting with the federal government about HIV and AIDS and where the future is going to take us. And we discussed this, getting to zero. And there were three pillars, if you will, about zero. The first one is zero new infections. So what does that mean? What we are going to strive for is zero new HIV infections. And nationwide, I want you to know that of all the people living with HIV, about 20% is estimated don't even know that they have HIV. And so that means that if you look at over 1 million people infected, that's a lot of people who don't know. So these people are some of the people who can be spreading HIV infection. So what does that mean for us here locally? It means we need resources to help get these people tested, get these people to know about their HIV infection. At St. Mary's and with the center, we're working to try to get people tested, get people to know about their infection. If that means outreach, going out into the community where people might be hanging out because they don't want to come to medical centers, get them tested there. We're also at St. Mary's, we're committed to working with the center about having more testing done by the center at St. Mary's so people can be tested. And we also just received a grant at St. Mary's so that we can do additional testing in the emergency rooms, because sometimes that's the only link that people ever see a doctor. And so if they can get tested in the emergency room, even if that's not why they're there, then they may learn that they are infected. And why is this so important? Because we need to get people tested and get them into care. There's a philosophy now of what's called treatment as prevention. And that means that if you are positive and you know that you're positive and get linked to care, get to the resources you need and get on treatment, your virus can be suppressed. We know that people who get on treatment and stay on treatment, when their viral load's suppressed, that they have a decreased chance of transmitting HIV. And actually studies in partners have looked that if a person's viral load is suppressed, they have a 96% less chance of transmitting HIV. And that means that HIV transmission can start to go down. If people are suppressed and there's not virus out there in the community, then people will stop transmitting HIV. So as a community, we need these resources. We need the resources for testing. We need the resources for outreach workers. We need the resources for people to have medical care that they can get to easily. And we need the resources for them to continue on medications. On a national level, the government, through the Affordable Care Act and through continued Ryan White services, are trying to continue to fund these programs. The second zero is zero discrimination. Why don't they get tested? Why don't they get in treatment? A lot of times it's stigma, and a lot of times it's fear. So you are the community. You are the ones who can help by stopping that fear. And we can do it together. We as a clinic do it, we as a community do it. The third and last part of the zero is zero AIDS-related deaths. HIV-related mortality has tremendously gone down. People have access to simpler, easier to tolerate medications that are effective over the long term and can make this a chronic disease rather than an immediately fatal one. Again, as I said before, health care is necessary. Providers are necessary. Funding for medications is necessary. Funding to keep people into care, whether that's through case management, other social services, mental health services, all of that is necessary, and we need to keep that support. And you, as a friend, as a partner, as a family member, can also help support that person for staying on medicine so we can get towards zero deaths. So today, I ask you, as you remember, to please recommit yourselves to trying to fight and to continue to fight this infection. Promote testing, promote safe behaviors, promote treatment, and finally promote an active and supportive community. Thank you.
Thank you, Dr. A, for your talk. It was very moving. I'm hoping that you guys all heard from her heart. In terms of the resources that we have, the Center Long Beach has been here for over 30 years now, and I've been very privileged to be working there for about 5 years. And the services that we provide there are incomparable to other services that are in other parts of LA County. Since World AIDS Day last year, so about